Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now, let's bring on the host. Here is Dr. Simmon Wilcox.
Good morning. We're back. I'm Dr. Simmon Wilcox. I'm a board-certified family practitioner, former emergency room doctor, presently undergoing the stem cell fellowship. And we're here to talk about longevity. Longevity with Dr. Wilcox. Well, at the top of the show, I just want to address the issue of vitamins. And we talked a lot about it, but I guess last week, CCN News, USA Today, a number of the medical journals said vitamins don't work. It was all over the news last week. Vitamins do not work. Vitamins do not work. Case closed. Vitamins do not work. So you can imagine the number of phone calls I've gotten at my office and from patients who've been with me who's saying, Doc, what do you think about this release that says vitamins don't work? And you've been for 17 years or so been pushing the issue of vitamins and how vitamins are essential, et cetera, et cetera, et cetera, and how we can help prolong our longevity by actually engaging in the appropriate supplementation of vitamins. Let me go on air and officially say I completely disagree with those news releases from last week. And the devil's in the details. When you dig down to the bottom of what was being said, when you pull the articles and read what they studied, they're talking about multivitamins. Multivitamins don't work is the way it should have been worded. Not vitamins don't work. And essentially they're saying what I said for 17 years. Multivitamins has a lot of everything, but not enough of anything to make a difference. Multivitamins have a lot of everything, but not enough of anything to make a difference. And they finally agreed with me, and that's fine. The reality is that when you're taking the one a day, the silver, the infant, the GNC men's one a day, there's not enough of anything in there to make a difference in the quality of your life, to impact substantially on any of the chronic diseases we struggle with, to make a difference in your energy level. All you're doing is creating expensive urine, but you're not getting to the bottom of your health problem when you take a multivitamin. Somebody's getting very, very rich. Someone else is creating a deficit in their bank account, but you're not getting to the issue of health and optimizing your longevity when you're taking multivitamins. So if you look at those studies, they really are saying the standard multivitamins have not proven themselves in any studies to be significant. And I won't argue with that. I think they're absolutely correct, but
Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now, let's bring on the host. Here is Dr. Simmon Wilcox.
good morning. We're back. I'm Dr. Wilcox. I'm board certified in family medicine, former emergency room doctor, and a stem cell fellow resident. There's a couple of questions we want to clarify. I'm learning that after each show, I guess what people are respecting the fact that they shouldn't both drink and drive, and they shouldn't drive and be on the phone. So individuals are waiting till they reach their destination to call us. As a result of that, we're actually getting lots of calls after the show is over. So a couple of calls came in last week after we had talked somewhat about stem cells and B17. And Tony, what was that question that an individual had inquired about?
Doc, we received a phone call from Alexandra, and she called about stem cells for the kidneys.
Stem cells for the kidneys. It's a good question. Understand that there are 90,000 people waiting for a transplant in this country. And the majority of people waiting for transplants are individuals waiting for kidney transplants. And so stem cells becomes a very important option because the number of people waiting for transplants has doubled in the last 5 to 10 years. Yet the number of transplants we're performing really hasn't changed at all because there's not enough options and not enough available kidneys to go around. So one of the better technologies now, or one of the innovative technologies that's going to help us address that issue is going to be stem cells. And we've talked about stem cells before, that the ability to tap into your tibia or into your pelvic bone and pull your own cells out. Using your own cell, they're polymorphic, they are progenitor cells, and these cells are able to become whatever you want it to be. The kidney issue is very interesting because it requires cell manipulation, so no one can do kidneys in their office. It requires the university, it requires a collaboration of doctors to look at answering that particular question. And what they're doing, particularly I think the leaders of this is out in Wake Forest, they're actually printing kidneys. Almost the same way you print money, they're printing kidneys. And what do I mean by that? They take one machine, they take a 3-dimensional view of your kidney, they tap into your bone marrow, and they pull out your cells. They then take those cells and pack them into a machine, almost like a sprayer, and that machine, which is called a printer, sprays those cells onto a 3-dimensional version of your kidney. So you come out with the kidneys the same exact size. And then you turn around and take that kidney. There's some further manipulation. I'm just I'm giving you a short version of this. And you turn around and take that kidney and put it into the body. And it was interesting. If you go to YouTube, I wish I had the site. There's a kid who's probably 19 now who 4 years ago got the first 2 kidneys that were printed, as well as a bladder that was printed. And so part of tomorrow's medicine, because this is not commercially available yet, you have to be part of the research study or a part of have enough money to go outside the country to where they're also doing this kind of work. But it's revolutionary. You actually can make an exact size organ replica of your own. They do it for kidneys, they do it for bladder, and they've been doing it for the liver. So in terms of Alexander's question, that's where stem cells are going relative to the kidneys. Ideally, I'm an autologous guy. I'm the guy who promotes using your own cells, not someone else's cells. But you can use someone else's cells if you had to. It requires a little bit more manipulation. You can in fact use relative cells. You can use non-relative cells, but the further you get away from your DNA, the more complicated the process becomes. But we do have some real options. We have too many people who are dying waiting for an organ, and that organ is not available. And so the answer for those unavailable organs is going to be stem cells. As I continue to talk here, those who are listening, please feel free to call us at 702-731-1230. And this issue of kidneys brings to mind for me how different our world is going to look 10 years out. If you look at what economists are saying that 70%, depends on who you read, some say 60%, of all the money spent in healthcare in the next 10 years will be on stem cells. What does that mean? That means you'll be spending a lot of money on freezing your cells, collecting your cells, storing your cells, and then you'll be going to various locations to receive those cells. So as opposed to going to the doctor getting a prescription for your diabetic medicine, you get a prescription to go back to the center where you stored your cells and have those cells reinfused to treat your diabetes. or you get a prescription to go to the center where you store your cells because you have a kidney issue, collect those cells, and then take them to the university and have your kidneys printed. It sounds very futuristic, but it's really in real time, really there already. It's going to take a while to work through the regulations related to it, but it's really going to change the future of medicine. Your Walgreens, your CVS, et cetera, will look totally different. They'll push a lot less drugs and a lot more stem cells. Many of your pharmaceutical companies right now are in the process of buying up the blood banks in this country, because at the end of the day, your cells will be stored in blood banks. So even though Big Pharma recognizes there's going to be less prescriptions on the table, they're still planning on being in the game, because what they're planning on doing is controlling where you store your cells. You have to pay a monthly fee for that storage, and then to have them extracted. So they'll still be around, but in a different format. So the future of medicine looks extremely different from what it looks like today. Again, please give us a call at 702-731-1230, 702-731-1230. Were there any other phone calls there?
There was another call that came in from Sarah last week, and she actually wanted to know about stem cells for breast cancer, or for breasts.
Stem cells for breast. I'm looking at wondering how much time we got before we go to break. We're 3 minutes. Let me start it, and then I'll answer the back part of that after we come back from break. I'm not sure where to begin with breast. Breast is probably the most political organ we have, and it's the most political organ we have based on a number of things. For radiologists, 70% of all lawsuits against radiologists is for misinterpretation or alleged misinterpretation of mammograms. And it's not because they're not good docs, they're great docs. It's just that it has more to do with the lack of sophistication of the mammogram. And so that when it comes to trying to evaluate that, many women and doctors are relying on results of the mammogram when you go to the visit. Doctor, they say, "Hey doc, how was my mammogram from last week?" The doctor looks at the results. The results say your mammogram is normal. Patient walks away happy. But then a year or two later, they come back and all of a sudden another mammogram shows a positivity. And so then there's a conflict, because you just told the mammogram was normal a year ago or 2 years ago. And I'm going to go into that in some more detail in a second, but let's move towards break. Again, we're at 702-731-1230, 702-731-1230, KLAV 1230, KLAV 1230 AM. And we'll be right back.
My name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. As a physician, I have 20 years' experience with drug and alcohol abuse. But I bring to you a new service at my facility for drug and alcohol. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Call Dr. Simmon Wilcox at 702-900-2953. Once again, that's 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953. Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210, behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
We're back. During the break, my INT person sent me a note and said, if our audience would just simply go to the internet and Google printed kidneys.
Printed body organs. Actually,
you.
I specifically went to YouTube, and everything that you're talking about came up plus more. So I prefer to have more information than not.
Okay, thank you for that clarity. Printed body organs is how you find it. It's on the internet. It talks a lot about how do you print an organ. I know this is a strange concept, the ability to print an organ the way you print money. But printed body organ.
Printing body organs.
Printing body organ. I'm learning as you're learning here, as he's doing work behind my back. So this is really live. Okay. You have a question?
I do have a question. With these printed body organs, is there ever an issue where the body rejects the organs that are put in?
Let me answer that. I haven't forgot about the breast, those who are listening. I'm coming right back to that breast issue. But the answer to your question is, if you're using autologous cells, if you're using your own cells, the beauty of using your own cells, whether you extract them from your tibia, your pelvis, bones, or your sternum, is that there's no rejection because of your cells. There's no need for suppression because you're using your own cells. So that's the beauty of the new age stem cells, is autologous stem cells. It's using your cells. Excellent question. Well, back to the question we started to.
Breast cancer.
Yes, breast cancer. Thank you, JR. Back to breast cancer we started before the break.
You were speaking about the mammograms, and maybe the machines aren't as accurate as they could be.
Yeah. And I have to be careful how I word this, but the reality is that mammography has resulted in tremendous advances as we relate to breast cancer and our ability to identify breast cancer. But even in the face of those advances, there are some shortfalls. Medicine is an art. As much as there, in theory, is a science, it's an art. And with the mammography, and the reason the radiologists have such a high lawsuit is not because the radiologists are bad guys, they're good guys. It has to do with the difficulty in the technology. If a female has fatty breasts and there is a cancer hidden in those fatty breasts, it is easy to find. Much easier than if you have dense breasts. If you have dense breasts, because in a female with dense tissue in her breast, as opposed to fatty tissue in her breast, the cancer hides in the dense tissue, and by mammography, the dense tissue and the cancer have the same characteristics. So it's hard to delineate. So it's a judgment call as to whether or not, when a radiologist is looking and that cancer is under 2 centimeters in size, it's difficult to identify the cancer. As a result, 6 months later, a year later, you get another mammography, all of a sudden positive. Individuals have a tendency to get upset, thinking someone missed the diagnosis. And therefore, here we go with the lawsuits that evolve.
Doc, a question as you shared with me about the mammography machine. What about women with implants? Would those get in the way of that?
Actually, you would think it would. And to some degree it does, but because the implants are pretty well circumcised, they're pretty well differentiated. That implant area inside the implant is, you can sort of look behind it if you have the right, if the test has been done right. So the implants do in theory get in the way, but it's not really the cause of the multiple lawsuits that was seen relative to that issue. So we have the issue of the lawsuits. When I say that the breast is very political, we have the issue of the fact that the United States Preventive Services Task Force a few years ago recommended that they shouldn't screen anyone under the age of 40 for breast cancer, and that created this uproar among the physicians, particularly the radiologists and the breast surgeons, saying, what are you doing? I mean, there's people out there who in their 30s who have issues, and you're saying not to screen before 40. After lots of uproar, then that issue was put to rest, and they stopped. They deleted that recommendation and allowed the physician to make the decision as to who should be screened, when and where. When you look at fatty breast tissue, the mammography has an 80% success rate identifying cancer if you have fatty breast tissue. If a female has dense breast tissue, the mammography only has a 40% chance of identifying an early cancer in dense breast tissue. So there's a problem there. 1 in 12, depending on who you read, females will develop breast cancer over the course of a lifetime, and we've heard a lot about the breast cancer. There is a machine out called, or machine development called MBI, which has to do with gamma radiation, and the gamma radiation actually gives you less radiation than the mammography and a sonogram, and it has more success rate, a closer to 90% success rate identifying the early cancers. So they still have that in development, trying to make a decision as to what to do about those particular early cancers. Now, what do we do if we can't get to the MBI because it's not available quite yet, and we have this issue of mammography that's not perfect? What do you tell the patients to do? Well, first of all, if you have a mammography has been performed, you need to ask your doctor, do I have dense breast tissue or do I have fatty breast tissue? If you have fatty breast tissue, then you could feel more confident with the finding. If you have dense breast tissue, then you should only take a mammography during the first 2 weeks of your cycle, because you're going to have a better chance of finding out what's transpiring if you take a mammography during the first 2 weeks of your cycle than the last 2 weeks of your cycle. So there's certain things you can do like that to try to improve the outcome in terms of identifying what is actually transpiring.
Are you talking about the menstrual cycle?
Yeah, in terms of the menstrual cycle. Exactly.
Okay.
Exactly.
So how does it affect men, Doc? Can men get breast cancer?
Actually, the short answer is yes. Men can get breast cancer, and particularly men who have a family history of breast cancer, and men with breast cancer. But there's genetic testing. Men tend to get something as a genotype BRCA2 that men tend to actually capture when they have the breast cancer. For women with genetic issues who are various family members in the family have come out with breast cancer, they get something called BRCA1. And you've heard the stories of celebrities who've gotten the mastectomies, et cetera, because of the history of the family history and the high chances, 70% also developing the breast cancer.
I think one of the more famous stars had a double mastectomy on the fact that she may get breast cancer. It was Angelina Jolie, I believe she did.
Yeah, and Angelina hasn't spoken to me, so I don't know. Exactly.
No, just what you read in the whatever, on these tabloids or the news, TMZ, which you got. Okay. But I thought that's a pretty crazy preventative measure. Doc, what would you think that if a woman had that heavily in her family, cancer and breast cancer, and she knew this at a young age, well, obviously she should, what can they do to maybe even prevent it? Is there anything they can do to prevent or help prevent getting it?
Well, there's certain things you can do to try to. We think that metformin is going to play a role. We mean the researchers think that metformin at the end of the day is going to play a role in reducing the chance of developing breast cancer. Obviously, the things we've talked about before relative to all the correct herbals, correct vitamins, etc., to decrease the insult to your telomeres. Because the more you insult your telomeres, that tail is on the cell, the more likely you are to develop cancer. There's been no studies to confirm that doing any of those things, though, will change your rate of developing breast cancer if you have a genetic predisposition to developing the cancer. So right now, there is no absolute good answer, and in the absence of that, females have been choosing to undergo mastectomy when they've been proven to have the genetic mutation that's going to put them at risk for developing breast cancer. So we still have a ways to go. The future is bright. There are individuals out there and different universities that actually will help with stem cells to build new breasts. We know they're already taking the body fat from the love handles and building breasts from that. Loma Linda is doing a lot of work with breast cancer and stem cells and regrowing breasts after breast cancer and stem cells. So there's a lot of hope in terms of where this is going to go. So medicine, like I said earlier, is going to look tremendously different when we get to be 7 to 10 years out.
Okay, I know you're going to fade. We're fading into a different segue. But what I was going to ask you, maybe we do this on a different show. But like the fear of men's cancer, for me, it's like prostate cancer.
Well, you have a much greater chance of developing prostate cancer as a male than you do than breast cancer. Having said that, though, any male who feels any type of lump in his breast should be concerned because men can get breast cancer, particularly those men who happen to have a higher predominance of estrogen in their bodies, which is determined by a test you do at your family doctors. But yeah, we'll deal with the prostate issue in a different show. But truly, the take-home message that men can also get it too. We're not the majority in this case, but we can get it too, so we shouldn't ignore that particular problem.
Okay.
Good. Very good. You're listening to KLAV 1230, KLAV 1230 AM. Please feel free to call us at 702-731-1230, 702-731-1230, and we'll be right back.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953. Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210 behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953.
Just about 4 years ago, I was longboarding, hit the side of a truck. This coming spring, I will have had 7 different surgeries. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. That's where the help comes in. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice is I've re-engineered how we approach the detox rejuvenation process. We offer a series of intravenous treatments. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
For more information on this miraculous treatment, call Dr. Simmon Wilcox today at 702-900-2953. Once again, that's 702-900-2953.
Longevity with Dr. Wilcox continues. Here again, your host, Dr. Simmon Wilcox.
Hello, we're back. We had several questions that was raised during the break. One was came from our last show on B17. Another one was to follow up to the subject we was talking about on breast cancer. Maybe we can have you ask that question on breast cancer.
Yeah, Dr. Wilcox, I was just wondering, what are the actual effects of a mastectomy? Because a lot of precancerous cells stay dormant and would not have been activated without so. So how much preventative measure is it actually helping? And can you still get breast cancer after a mastectomy?
The short answer is if you only have a mastectomy on one side, the answer is yes, you still can get it on the other side. For those who are genetically predisposed, and meaning those who have been confirmed to be at genetic risk by genetic testing, they have a 70% chance of developing that particular cancer. Once the geneticist has determined they carry the gene mutation. So 70% chance of getting it, which means a 30% chance of not getting it. If they choose to undergo a mastectomy, they're going to have to make it make sense. You do a bilateral because you don't know which breast was going to be the problem. If you undergo the bilateral mastectomy, then in theory, you have a 97% chance of resolving the issue. There's still a small chance out there, but in theory, you've actually gotten rid of all the breast tissue, so in theory, it shouldn't reoccur. But in medicine, nothing's 100%. So there are still some lingering risk factors out there. But you've drastically reduced your chance of developing it if you've been proven to have be one of those who carry the genetic mutation for it. Okay, thank you for that question. There was another question there, Tony. There was a follow-up question from last week's discussion.
Right. One of our callers, Ed, had a question about the B17 that you had brought up, and you had made a comment about going to Mexico and basically getting the cocktail made down there. Ed wanted to know exactly what that cocktail was and how long it's going to take.
The cocktail I was referring to is a cocktail at the hospitals down in Mexico. Oasis of Hope, and again, I have no financial relationship with this particular facility. They did not pay for any commercials on my show. I don't even know the doctors that work at that facility, but Oasis of Hope is one of the facilities that I'm aware of. I'm down just below Tijuana, where individuals have gone to receive this intravenous treatment for B17. That cocktail, if you will, I know includes B17. I don't know the exact dosages of the B17 administration. I know it includes intravenous vitamin C, as well as a number of other things. They try to control even what you eat when you're there. Because at the end of the day, one of the things that I often get frustrated with in the American system, we put you into the hospital, but we still feed you food that aggravates your condition. We still feed you foods that have high oxidative insult, that gives you a lot of free radical release, and it's the free radical oxidative insult that put you at risk for developing the cancer anyway, as opposed to now feeding you the proper diet to make a difference in terms of juicing, etc. And I think that at some point in the near future, we're going to change how we feed sick people in this country when they're in our institutions. They've been proactive with that down in Mexico, and they've taken a step right now. But it doesn't make sense to go into a hospital, be admitted to a hospital for cancer, and then continue to feed foods that tend to precipitate cancerous type activity in the body. Now, part of that has to do with traditional doctors haven't gotten to the point where they've bought into that, but they're getting closer to understanding that is in fact the issue. But to answer your question, there are a number of facilities. The one that I'm aware of is Oasis of Hope, and they do intravenous B17 intravenous vitamin C, as well as some other items. And it's probably a 5-day or 6-day experience down there. And I'm not sure what the cost is. One can call, you can Google the name and identify that. Okay. The other issue that arose last week after we talked about B17, because individuals call the office asking, where's this B17 coming from? B17 is a natural vitamin. You find it in bitter almonds. It's in apricot seeds. It's in apple seeds. It's in plum seeds. It's in blackberries. It's in raspberries. It's in cashews. It's in pecans. And so those of us, when you step back and think about it, if B17 is in all those things that we eat normally, we go to the store and buy every day, why was it outlawed as being toxic? And that's the real question and real concern that and as I said before, they outlawed it because they said that it was toxic to normal cells. Everything that I have read says it's toxic only to cancer cells, only to those cancer cells, and makes those cancer cells, in fact, implode on themselves. But you do not have this implosion, you do not have this destruction of normal cells. So because it's been outlawed, people are still leaving the country, getting what they call layer trail, and they're getting that everywhere from Europe to Canada, on all these medical tourism programs. They're getting it in Brazil, and they're also receiving it down in Mexico. Okay.
Hey, Doc, you mentioned something to me that was interesting about B17. When we were speaking about it, and then you said, you can buy it freely even on the internet. And I said, well, that's interesting. But if people buy it on the internet, then they got to administer it themselves, and it's mostly in a pill form. But she made an interesting comment to me, saying that even if you do buy it on the internet, that you're not even sure if the proper dosage is being diagnosed.
Well, yeah, you can buy it on the internet. There's American companies that sell on the internet. The issue that everyone has, that I tell patients all the time, is that you're going to the GNC buying vitamin C, not knowing how much you should be buying. You're out there buying D3, not knowing what dose you should be using. And when it comes to cancer, it's even more complicated. And you're buying because you're reaching for an answer, you're reaching for hope. And so they're buying it and trying to do the right thing. But at the end of the day, they need someone who they can consult with to find out exactly what the dosage should be. We do a lot of that consultation for people who are buying the multivitamins every day, who are trying to do the right thing in terms of their organic supplements, their calcium, their copper, all those items. And we bring them to the table and say, look, this is what your real dose happens to be. And if I determine today that you need X, Y, and Z, and these are your dosages a day, your body's requirement will change. So you need to come back and go into another consult in a year or two to confirm that your dosage and your body requirements are still the same as they used to be, because things change with age. So again, all we're trying to do is have people spend their money in an effective way, that they're really getting the biggest bang for their buck, and they're not just creating expensive urine. But yes, they have this B17 item on the internet. I can't attest to what the quality of it happens to be. Clearly, and I can't attest to whether or not oral B17 can make the same difference that intravenous B17 will make when they go down to Mexico and other places like that to have it. I do understand, though, a number of the comprehensive cancer centers around the country have begun to add B17 as part of the vitamin therapy here in this country. So that's interesting. That's a step. I think that's a step in the right direction. Yeah,
that's good. I know it. A friend of mine passed a few weeks ago of cancer. He had throat cancer, and he pretty much beat it, and then went to his lungs. But his daughters were research maniacs, and they did a great job. And we actually remember we visited him in rehab, and
I remember visiting him in the bedside.
And he was doing great. But they they even said it even at he's passed at his funeral that the B17, the alternative medicine treatments, actually prolonged his life for another 4 years.
Oh, they did?
Yeah.
Okay.
Yeah.
Okay. Well, there's a lot out there, and there's more than one way to skin a cat. And so there's multiple approaches to every single disease option that we run across in life. And it's hard to know what is the absolute right thing to do for any particular person at any particular point in time. You make a decision based on information given to you by a doctor, information you've extracted from different people you've talked to, and then you decide what best meets your diagnosis, what treatment modality best meets your pocket and your financial ability to innovate and activate that particular activity. So it's awful difficult. We serve here as consults to try to point you in the right direction, to help give you clarity. Whether the direction is a Wake Forest University in the East Coast, or whether the direction is to my mentor, Dr. Maharaj in Florida, or whether the direction is to somebody over in Bangkok or Mexico. We serve here to give you direction when you're in need. Again, you're listening to KLAV 1230, KLAV 1230 AM. Call us if you have questions at 702-731-1230, 702-731-1230. We'll be right back.
Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210, behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210, behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953.
My name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. As a physician, I have 20 years experience with drug and alcohol abuse. But I bring to you a new service at my facility for drug and alcohol. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Call Dr. Simmon Wilcox at 702-900-2953. Once again, that's 702-900-2953.
You're listening to Longevity with Dr. Wilcox. The phone lines are open at 731-1230. Now, here again, your host, Dr. Wilcox.
Hello, we're back at the bottom of the hour. If there's questions that have come up for you, please call us at 702-731-1230, 702-731-1230. JR had an interesting comment during the break, and why don't you just react to that question, JR, about the treatments for cancer patients?
Well, I was wondering that if there's things that we can do, which I believe there are, to make people who are going through those treatments, make them live a little better, feel better.
More comfortable.
Yeah. Maybe feeling better through their chemo.
Exactly. Well, one of the things we do at the office, while you're getting your chemo from your oncologist, because so much of the chemotherapy leaves you nauseous, leaves you vomiting, leaves you not feeling well, causes you to have loss of hair. At our facility, we have some concurrent treatments that actually improves and limits the side effects that you normally receive from the chemotherapy. Again, those intravenous omegas, the intravenous glutathione, the Myers cocktail, we often will administer to a patient for 1 or 2 days prior to the chemotherapy and 1 or 2 days after the chemotherapy, along with the permission of the oncologist. We talk to them about this, so that you limit the side effect you're having from the chemotherapy, because most people are down for a day or two after the chemotherapy, and they prefer not to lose 2 days or 3 days after receiving the chemotherapy. The other thing we do for those who are losing their hair, we work hand in hand with some hair laser specialists that are right there across the hall from us, and they have this new high-end technique to help prevent and limit the loss of hair that you may have from the chemotherapy by doing a lot of what you call laser regeneration of the scalp. So the degree of hair loss is nowhere near what we normally would see. So we do a number of things sort of to hold your hand, walk you through the process, and we talk to your doctor to confirm that what we're doing is not in conflict with what they're offering you.
Awesome.
Yeah.
Awesome. That's great.
Yeah. So you don't have to find yourself stuck and with this fear of next Wednesday I gotta get my chemotherapy again, which means next Thursday and Friday, or probably even Saturday, I'm gonna be out of the box. I'm not gonna be functioning. I'm gonna be there at home working through these side effects. But we've also learned the same treatment that we give prior to the receiving the cancer medications, the chemotherapy. We give the same treatment for patients just who are going for operative procedures, so that they're we give it to them preoperatively treatments. Post-op, their recovery time is a lot faster from wounds, whether it's a gallbladder surgery, whether it's a elective plastic surgery, that the recovery time is a lot better once they've had these particular treatments, because all we're really doing is enhancing the cell membrane, the cell recovery, enhancing your mitochondria so it's able to provide you with better energy and limit the nauseousness that you get even after surgery. So we improve
from the chemo and from the surgery.
From the chemos and from the surgery. Yeah.
That would be glutathione would really step in and do a powerful job there, Doc, when it's a mother of all antioxidants. So if they're going to go in to get a surgery into a hospital, a lot of people come in just to get a basic surgery, and sometimes they come out with the infection. I mean, it's been going around lately.
Well, infections is a given side effect of surgery. It's a given side effect of going into the hospital.
Right.
The treatment we give don't reduce the chances of infection. It does improve your recovery from the infection, but it doesn't reduce the chances of you actually catching the infection. We tell people all the time, there are patients who like to go to the hospital. You just feel that's a safe haven, but I tell them every time you walk through those doors, you expose yourself to all the other bugs that are in the hospital.
Yeah.
And sooner or later, if you go through those doors enough, you're gonna catch some hospital-written infection, and hopefully, if you catch it, then it gets resolvable and doesn't turn into a life-threatening issue for yourself. You just want to be very careful about that. But yeah, what we do, we don't have the ability to prevent them from developing an infection, but we can certainly improve the outcome if they develop one. We certainly improve the outcome when in terms of their post-surgical recovery rate from orthopedic surgeries, from all kinds of surgeries, if they go through our pre-surgical treatment sequence and our post-surgical treatment sequence. So that is available to clients. Okay. As they want. They can come in and do a consult. We'll talk about it, map out what the program would be, talk to the doctors about it, and implement it should they choose to implement it at the end of the day. Okay. You're listening to KLAV 1230 AM. KLAV 1230 AM. Please call us at 702-731-1230, 702-731-1230. We'll be right back. I got my prescription pad with our address on it.
My name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. As a physician, I have 20 years experience with drug and alcohol abuse. But I bring to you a new service at my facility for drug and alcohol. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Call Dr. Simmon Wilcox at 702-900-2953. Once again, that's 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953. Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210 behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
We're back for the last part of the show today. I just want to clarify, just on a question that came in on the breast cancer we were talking about at the top of the show. A research MD by the name of Deborah Rhodes had done a study on 1,000 patients. In those 1,000 female patients, they used mammography and the new technique called gamma. And mammography, of those 1,000 females who happen to have cancer, mammography identified 23% of those. The new process called gamma identified 83% of those. So these are individuals who apparently had cancer, undiagnosed cancer at the time, and the cancer was less than 2 centimeters. So it just to answer the question, there is a study, and there may be more, confirming that the gamma technique is in fact a better technique than the traditional mammography. It certainly doesn't hurt as bad. Mammography squeezes that breast tissue. The gamma is more like a regular kind of an X-ray for those females who are going through it, and it certainly offers less radiation than the MRI. And the issue being, as we close the show out, the issue being that the denser the breast tissue, the higher the risk you are for developing the breast cancer. This is not even considering whether or not you're genetically predisposed, but just the denser the breast tissue, the higher the risk you are. Many women with dense breast tissue carry that dense breast tissue until their early 40s. Then after the age of 40, still 1/3 of those individuals with dense breast tissue continue to have dense breast tissue, so that they continue to be at risk even past menopause for developing that cancer issue. I'd like to thank you for, again, listening to our show. We welcome and we're thankful for all the questions and all the support we've been receiving since the show has started, all the phone calls from all around the country. As I've learned, the show has been now being re-aired in different portions of the United States, and I understand we have a number of listeners on the internet listening to us from different areas of the United States. So we're getting phone calls from everywhere, emails from everywhere, and we appreciate all of that, because we have no way to gauge who is listening to us as we're sitting here in this little studio with 4 walls. We just don't know. So when you call us, when you email us, you give us a sense that what we're doing, we're able to judge if we're doing it right, if we're doing it wrong, if we need to make adjustments. So again, I thank you. We appreciate you. Enjoy your holidays. You're listening to KLAV 1230 AM, KLAV 1230 AM. Call us 702-731-1230, or you can call our office at 857, that's not the number is 7111 749 7111. And then there's a Google number, 900 2910. 900 2910.
53.
Thank you much. Have a good day. Enjoy your holidays.
Merry Christmas.
You're listening to Longevity with Dr. Wilcox, and Merry Christmas.